So this is our presentation for our stress assessment by Francesca, Angela, and Caitlin.
So we're going to begin just with a background of stress. So to begin, stress is the body's kind of natural way of responding to events or situations that might be difficult to deal with. And an important thing to note is that stress is not an uncommon experience, and it is the body's way kind of to respond to danger or uncertainty. So another way to put that is everybody experiences stress at some point in their lives. Stress causes a physical, emotional, cognitive, and behavioral reactions in people who are stressed. Oftentimes, it also affects behavior. And stress doesn't necessarily cause each and every one of these responses, but they're just the common ones that do occur. So, for example, someone who is overly stressed, they might change their eating habits, whether that means they eat more than usual or they feel so stressed that they feel sick to the point where they're not eating enough. Can also lead to an increase in drug and alcohol use. So as I said, there's many different symptoms of stress, and they all take a toll on the body, and they can cause mental health problems like anxiety or depression, and medical problems like hypertension, heart attacks, and stroke. So what happens exactly when the body becomes stressed? Well, there's an increase in cortisol, epinephrine, and norepinephrine, and those are the different chemicals that the body produces to confront danger. And when these chemicals are produced, there's an increase in muscle tension, sweating, arousal. It also creates high blood pressure, among other different symptoms. And so the chemicals all work together to improve the body's capability of responding to harm. So some of the physical symptoms that stress can induce include low energy, muscle tension, high blood pressure, headaches, upset stomach, trouble sleeping, clenched jaw, and sexual dysfunction. Emotions are also impacted by stress in different ways, such as feeling overwhelmed, feeling out of control, having a low self-esteem, feeling sad, increase in anger and irritability, and difficulty relaxing. The cognitive effects of stress are like constant worrying, difficulty concentrating, poor judgment, racing thoughts, and pessimistic thoughts. And I kind of already touched upon this, but stress also impacts behavior such as angry outbursts, smoking, drug use, increased alcohol consumption, erratic sexual behaviors, over or under eating, procrastination, social withdrawal, and engaging in anxious behaviors like nail biting and fidgeting. So stress does look different for everybody. So it's kind of difficult to identify stress, but those are just some of the common ways that it does affect the body. So stress also has different types of stress, and these can kind of be thought of as good stress and bad stress. And good stress is called eustress, and it might be difficult to think like, how can stress be good for you if it creates so many negative symptoms? But things like starting a new job or having a baby, getting into a new relationship, taking a vacation, all of these things can be thought of as good stress. And of course, there are some negative feelings that are associated with the events, but most of the time it is positive stress that comes along with these things. And when someone is experiencing eustress, they feel more productive and focused, and they don't feel as run down or paralyzed by how they're feeling. It also promotes self-efficacy. And kind of on the contrast side, eustress is the good stress, and then there's distress, which is what we're probably all most familiar with. And this is the negative stress that comes when something dangerous or life-changing happens. And Distress can also be caused by small things like running late or having too many projects to work on at one time. It is also important to think about like the amount of time that stress lasts for, so whether it's acute or chronic. Acute stress is typically stress that is experienced in the short term. It concerns recent situations or the anticipation of challenges in the future. So once the person is able to control or resolve the situation, the level of stress diminishes. And it typically has an immediate solution, which makes it easily solvable. But on the other hand, chronic stress is stress that develops over a long period of time and generally causes more problems like cardiovascular illnesses and immune issues. Chronic stress is also typically ongoing and doesn't have a clear solution. For example, poverty or an unhappy marriage. And chronic stress is typically dangerous and can cause many health issues, like I said before. So stress can make a big impact on everyone's life in a variety of ways. For example, drinking, engaging in sexual activity that's dangerous, drugs, or cause medical problems. So it is important to kind of like keep track of your stress and not let it get out of control. So now we're going to talk about different stress assessments. So the most widely used stress assessment is the Perceived Stress Scale, which was developed by Sheldon Cohen in 1983, and it measures stress by asking questions about thoughts and feelings in the past month as they relate to stress. So the test taker is instructed to respond to the questions thinking about the last month of how these symptoms have occurred, and it's scored using a 5-point Likert scale, and it ranges from very often to never, and is made up of only 10 questions. So it's a very quick and easy assessment to take, which is probably why it is one of the more popular ones. So there are two other types of stress assessments that are popular, and those are the Ardell Wellness Stress Test and the Stress Coping Resources Inventory. I'm not going to go into too much detail about those just because we wanted to focus our assessment on the Perceived Stress Scale. And so while it does have a high reliability and adequate validity, we believe that the assessment is outdated and can use improvements. And so that's one of the main reasons that we wanted to make an assessment for stress. It was created in 1983, and as it is the most widely used stress assessment, we believe that it could use some updating since there are cultural changes that have occurred, and I imagine that stress is experienced much differently now than it was in the 80s. So we also wanted to include questions on our assessment that were culturally relevant, such as social media use, because that definitely was not something that was prevalent in the 80s. And so we think that including that in our assessment would be beneficial. And overall, we just thought creating an assessment similar to the Perceived Stress Scale would be beneficial and useful to make something similar to what is already used, but instead update it a little bit so that it is more culturally relevant.
Okay, so for the nature of the assessment. So for item content, we wanted to assess the presence and the severity of symptoms relating to stress, pertaining to one's thoughts, emotions, behaviors, performance, and relationship with others. We also wanted to include lifestyle aspects that may be contributing factors to high stress as well. So for example, changes in relationship status or financial stability, those can help us Gather information about current life stressors that may affect the levels and the scores ultimately that individuals get from taking this assessment. And then also we wanted to include demographic information. This was not scored on our assessment, but again, it provides us with more insight to possible life stressors and to examine demographic splits and breakdowns. So we can examine different correlations between. So next slide. So source of reporting, we have decided to make our assessment a self-report. I'm going to elaborate a little bit more on that in a minute, but we also decided that it could be administered by a trained professional in a clinical setting as well. For our target population, we wanted to make sure that they were employed full time. We felt that it was necessary to do this because we thought that that was in itself a stressor. Of course, everyone experiences stress at all ages, but we felt like that was a group of people that experiences higher amounts of stress due to working full time and then other stress that make it as well. And then we also have no specifications for graphic correlations. So now I just want to dive a little deeper into all of the bullet points that I went through just to kind of give a better example of why we created this the way that we did. So the items on our assessment are going to be directly related to the symptoms of stress. So stress, as Caitlin mentioned, is a very common experience by everybody. And there are various symptoms that a lot of people experience, such as fatigue and irregular sleep, agitation, avoidance. It can affect your eating habits. And essentially we found various sources that all supported this. So we wanted to make sure that our questions reflected that so that we could get a really good idea of what symptoms were present in the individual's life, as well as the severity of those symptoms. We felt like this is important for education purposes to know exactly what stressors are presented in someone's life. And also it gives, in a therapeutic setting, a really good baseline to understand what coping mechanisms might be helpful, how we can implement different stress management skills to better help any client that we work with. As mentioned before, we also included questions regarding life aspects. And I kind of mentioned this as well, but we really wanted to gather information that could give us ideas of potential stressors that may be present in someone's life. So for example, if someone is going through a breakup, or if someone is currently moving or starting a new job, these are all different stressors that may be affecting someone's overall levels. And although our assessment focuses a lot on different negative stressors, this can be positive as well. So as Caitlin mentioned before, entering a new relationship or going on vacation, these are still life aspects that we want to make sure we're assessing just to get a better picture of the individual's life. And then we also included the demographic information. I kind of mentioned this as well about figuring out if there were any correlations. So if there were any gender differences, if race played a contributing role into different stress levels, occupation, education level, etc. The reason that we made our assessment a self-report is because we felt like the symptoms of stress are very personally experienced. And if we had observational reports, there might be discrepancies in the actual experience of the symptoms. It's really all about how the individual is feeling, and that can be really hard to view from an outside perspective. However, we did, like I mentioned, include that it could be administered by a trained professional who understands how to administer the assessment as well as score it. And then lastly, we wanted to stick with the adult population that is working full time because we really felt like this was a population that is kind of at risk for higher stress levels, just because as you get older, there's more stressors that are presented in your life. If you're working full time, that already adds a lot more to your plate. And it just helps us stick to one population so that we can kind of understand different correlations and different, the prevalence of stress among that group of people.
Okay, so moving on to the administration and scoring of the assessment. So just to go over the instructions for administration. So obviously when you start the assessment, the therapist should know to hand the individual the assessment and the pencil. And it's important to remember to tell the client to take their time and try to answer every item as honestly as possible. Also, it's crucial to remain a neutral party in order to refrain from influencing the client's responses. So if you give them feedback, you know, while they're contemplating an item, or if they ask you for further clarification and you kind of build on that more to create more introspection, then it could impact the way that they respond and rate that item. And then when scoring the assessment after it's completed, be sure to be aware that some questions on the assessment are reverse scored. This is really important because these items that are reverse scored, we'll go into it later, but they're positive items that are opposite of symptoms of stress. And so therefore they would not contribute to an individual's stress levels. After you score, be sure to debrief with the client and make sure you ask them how they felt and what was going through their mind while taking the assessment. This part is really important because it allows you and the client to recognize possible correlations for high stress levels. Maybe you can indicate the main stressor that is causing all these problems, or if there's certain physical symptoms that are present more than others. These are really important to take note of. And then also, if high levels of stress are indicated through the scoring, you want to try to offer the individual with coping skills and mechanisms. You know, ask them, oh, when you feel stressed, do you find that certain things work better for you? Is there an activity that, you know, occupies your mind to take away the stress? Is there certain exercises that you like to do, like yoga, meditation? Maybe you like to go on a run. Does this help relieve your stress? And you can sort of plan with them, create a plan for future circumstances and how to move forward with treatment and interventions. And then one item that, or a couple of items that we said is important to draw attention to when debriefing with the client. Like I said before, you know, trying to pinpoint that direct cause of stress. Those will be located in items 21 through 28 of the assessment. And we'll go over them, but they're items such as, have you started a new job? Have there been any significant changes in your relationships? Are you satisfied with your work life? Things like that, that talk about general life circumstances that often influence an individual's stress levels, whether they're positive or negative. And if there are certain things, you know, try to encourage them to talk about it. And it will help you evaluate their feelings, thoughts, and behaviors about these situations. And while these situations occur, maybe you can identify certain, you know, triggers that they find cause more stress than others. If there was something that they did in that situation that really helped, things like that. And then some important instructions that are communicated to the client. All of the important instructions are noted on the assessment itself, which, like I said a couple minutes ago, we'll show you guys later. But the first thing that the client should be made aware of is that this assessment is obviously designed to evaluate stress levels, determine if there's something in particular that's going on, help them notice their symptoms. One thing that we added was for answering those top questions. We have top demographic questions at the top, you know, such as name, age, relationship status, occupation. Those are open-ended questions that only serve to collect demographic information about the sample. So, you know, when creating those norms later on that Caitlin will talk about, how we're going to assess for the norms and the sample population that we receive. Similarly, it's important for them to know, and it is noted, that when answering questions 1 through 20, you want to think about the past 2 weeks. And each question, you know, will ask you to indicate how often the statement applies to you if you were reading the assessment. And when rating the item's frequency, the individual can refer back to the 5-point scale that is provided at the top before the questions are there. And then they'll know to complete this assessment, just items 1 through 20 using that 5-point Likert scale. And then for when answering questions 21 through 28 regarding life experiences or certain life circumstances, it's important and noted that they should think about these questions within the past 6 months, and simply indicating yes or no. And also reassuring that they know that although it is preferred that they take their time filling out this assessment, it's important to not become too inquisitive about each item. So they don't want to spend too much time trying to, you know, count the number of times they've had body aches in the past 2 weeks, or trying to count the exact number of months ago that they started a new job or, you know, moved. They don't want to like spend too much time. They need to be not necessarily on the fly, but pretty quick answers. And that they should know that if they're having a hard time reflecting over those life circumstances, so if they're like, oh, I don't really know, it's better that they just indicate no. That's perfectly acceptable. You know, when the therapist goes to debrief after completion of the assessment, they can sort of try to pinpoint those on their own through a little self-reflection and introspection through that talk therapy that they'll go through with the therapist. They can also know that once they've completed the assessment, they can determine their own score. It is pretty easy to figure out the score, which we'll go through next, but they don't necessarily have to. The administrator or the office, wherever you go, wherever you receive this assessment, they can figure out your score for you. Oh, there's a typo. So not a 4-point Likert scale, but a 5-point Likert scale. That's okay. So similar to the PSS, we decided to go with the 5-point Likert scale for this assessment, just 0 through 4. Pretty easy to follow. 0 is never, 1 is rarely, 2 is sometimes, 3 regularly, and 4 is very often. So when this is presented, reflecting back to how the items are presented to the client, they're thinking back on how often these items related to them within the past 2 weeks, and how often they've occurred. So in scoring the assessment, it's best to first start by reversing the scores for certain items. And those are 5, 7, 14, 17, 18, and 20. And while reverse scoring may seem a little confusing and a little hectic, it's pretty simple. All you have to do is basically just reverse the values of the numbers. So a 4 would be a total of 0. A 3 would be 1, 2, 2, and so on. And finding the score for this assessment is relatively easy. Even if you're not good at math, you can use a calculator, but you're just adding up the scores for items 1 through 20. So this following the scale of a 0 being a 0, a 4 being a 4, so on and so forth. And remember just that items 21 through 28 do not necessarily count towards the score. They are simply to gather information. And it's up to the discretion of the therapist or the administrator of the assessment to determine whether or not the answers to those questions are important, significant, maybe could be a variable that is directly relating to the level of stress that is indicated by the client score, which can be seen. We put a little graph on the right-hand side. So what we did with the scoring, you can get a total of 80 points. So it's from 0 to 80, 80 being the highest score, indicating that you rated a 4 on every single item that goes to the assessment. And which would be very often. And there are 3 proposed cutoff scores that describe a client's stress levels. There's a low level, a moderate level, and a high level. So for low level stress, the final score of the assessment will lie through a 0 through a 24. For moderate, 25 to 52, and for high, 53 to 80. And we decided to, divide the cutoff scores this way. It was a pretty simple decision, but we divided the highest possible score, which was 80, into equal parts. We decided we wanted 3 different levels for stress. It seems like a pretty common, categories that are seen through multiple assessments, and coming across all the other stress assessments like the PSS and the wellness test. Those were similar in dividing the scores into like the cutoff subcategories. And it's into equal parts. So there can be an even number of ratings, and it's pretty obvious if an individual indicates all 4s, they're going to have a high level of stress because the items that are on this assessment are directly symptoms of stress. And even if they indicate a 0 on items that are reverse scored, they still get 4 points. So they couldn't engage in that positive mechanism and intervention for stress. Like I said before, the scale similar to the perceived stress score, and just all we did there was we edited the wording for clarification. Their clarification was a little wonky, and it could be perceived in different ways. So they just, use like not very often, and we changed it to never, because we, when people see the word never, they're like, oh, that never happens to me, so I don't have to worry about it. And it was, I think what it was very often or rarely often, one of the two. And it's just the way individualized perception can make it a little confusing for people and make them sort of reflect and introspect a little bit more than is desired. So I'll continue talking about the development of the assessment. So as I was talking about before, with the scoring and the instructions for administration, this was our original assessment. As you can see, it's pretty basic. The scale is right there in the center, so you can always look back to it. It was just the 20 items, lines right next to it, so on and so forth. The last 21 through, originally we only had 27 items, and you can just circle yes, no, and that was pretty much it.
So after we created our assessment, we went ahead and sent it out to family, friends, people to just take the assessment and give us some feedback, whether or not they thought it was straightforward, if they could give us any feedback about the questions we asked, if there was anything confusing. And generally we got pretty good feedback, saying that it was pretty straightforward, clear to understand. The questions measured stress levels accurately. The questions were also thorough, asked about different aspects of life, whether that meant drinking or like if there was a new life event that happened or muscle tension. Like we tried to cover all the different things, but some of the constructive feedback we got was, what does normal mean? So if you saw in the previous couple of slides, we asked a couple of questions that were phrased as, how often have you eaten less than normal, or how often have you eaten more than normal, slept more than normal, or slept less than normal? And so one of our participants wanted to know exactly what normal meant, which is a very good question, because it's very subjective, and what's normal for one person may be completely different for another person. So it's very important that we define those terms. Another feedback that we got was that there were unclear instructions for the demographic information. So as you saw at the top of the page, it asked some just general questions like name, relationship status, age, race, gender, all those types of things. And so we didn't actually put any instructions in there, but it was unclear to our participants how they were supposed to respond to that, because typically when you look at other assessments, they have choices that you can circle or options to check off or something, and ours did not. And instead it was just open-ended so that people could write what that meant to them, which looking back is a bit confusing because it's not something that you see often. So we made sure to put that into the information for the therapist or whoever's administering this assessment to make that clear prior to giving the assessment. And we also got a suggestion to add a question about like satisfaction, whether that be like with, are you satisfied with how your life is going, or are you satisfied with the job you're working? And we thought that was a really helpful point of advice, because it would really tap into some more about this person's experiences with stress. So we decided to add that into our final version of the assessment.
So some of the revisions that we made based off of the feedback that we received, like Caitlin just mentioned, we ended up adding item number 28, asking if they were satisfied with their job, which is something that we've been talking about in class as well, with work satisfaction and how that can interfere with one's mental health. So we felt like that was a good question to put onto our assessment. We also added a time frame for questions 21 through 28, and indicated that they were to answer those questions regarding the past 6 months, so that they had a time frame to work with. So it wasn't completely open-ended, but still longer than the 2-week period that we were asking for the scored items on our assessment. Another revision that we made was for items 11, 12, 15, and 16. We had asked questions like, what is, have you been eating more than normal? And we were told that, or asked, what is normal? And we felt like that was a really great feedback. So we decided to say, what is normal for you? Since everyone is different, eating more or less, it can't really be quantified based off of just one normal baseline. So adding that for you made it more specific and individualized to what the person experiences, so that they have a better, or an easier time rather, judging if they have been eating more or less. So we did that for questions 11, 12, 15, and 16. And then for the first 7 questions, we decided to make open-ended. These were the demographic questions asking about your name and gender. We had thought about having boxes to check off, or, say for relationship status, if they were married or single, but we felt it was more important to just leave it open-ended to see how the individual see what the individual wrote down, kind of left it up to their discretion. We thought that would provide better insight for us. And then although we added that item, we did not remove any of our original items.
And so as you can see, compared to the original assessment, there's a little more going on, especially on that picture that you see on the left-hand side of the screen. So you can see where we added information about, those top questions being open-ended, assured them that it was just to collect demographic information, And this is also, explained through the administrator. Answer them how they want to, answer them how they perceive them to be. And nothing really changed for the other items. You can see it still remained the same. The scale's still there. And then the bottom right, you can see item 28 added with the 6-month specification. And we also wanted to add a little picture of our scoring instructions. So you can see that it reminds the individual that, those last 8 questions do not pertain to their score, simply to gather information. This is really just for the therapist to create conversation, to foster more analytic thinking, maybe figure out, what is the stressor? Maybe this is good stress you're experiencing, but you're just not handling it in a healthy way. So what can we do? How can we work as a team to implement future interventions to help you get some coping strategies, and really determine what the root cause of your stress is. And step by step, the scoring is explained. So list out the questions so you can't, you don't have to figure it out on your own, their values, and it gives you a little spot to total up your score. And once you find your score, you can just look directly underneath, just match your number to the level of stress, and then the assessment is completed.
So an important thing to look at when creating an assessment is the technical evaluation, or like the psychometrics of it all. So that is what we're going to focus on for the next few minutes. So the first thing that we are going to focus on is the norms of the assessment. And Angie kind of touched upon this in the beginning when we discussed how we kind of created the assessment and who it was tailored towards. So the ideal, in quotes, participants for this assessment would be those who are adults over the age of 18, and it would be best if they are employed, whether that is a part-time job, a full-time job, a couple hours here and there, because as Angie said, it is more likely that those who are employed are going to have higher levels of stress. We had no ideal participant for gender, race, ethnicity, relationship status, etc. We really wanted to get that demographic data from the participants as a way to further understand and analyze their stress levels. It is likely that there will be a difference in gender, race, and ethnicity in terms of how they experience stress. And it can also lead to further research and inferences as to why certain populations have a higher level of stress compared to those who have a lower level of stress. And very similarly, we have no expectations set for sexual orientation, relationship status, as we would be interested in seeing which populations reported more stress than others. We also asked for educational level at the beginning of the assessment in order to kind of assess what participants' stress level is like, and if there is a correlation or connection rather between their stress levels and their educational levels. And that being said, the ideal participant could have any educational level. And that being said, we created the assessment with careful word choice so that anybody could really understand it. And as we already kind of discussed, the only thing that we really were adamant about was that the participants were over the age of 18, just because it is more likely that those who are 18 have a job, or maybe they're in college, or working in an environment that is high stress. And so we just want to evaluate that. And so to obtain this sample size, we would want to advertise our assessment in a variety of places. For example, we could use social media, because that is a place where a lot of people spend their free time. So we could post on Facebook, Instagram, Twitter, etc., whatever people use in their free time to just leisure, and they could happen upon the assessment and view their stress levels. We also thought it would be interesting to post the assessment in, say, like doctor's offices or medical buildings or other mental health places where people could just like scan a QR code or take a screenshot or follow the link on their phones and take the assessment in a place that they frequent. We thought that that would be a good idea because perhaps those who are at a doctor's office often have higher levels of stress, which we could examine if they were to find the assessment through their doctor. Another place that we could advertise is dorm buildings on college campuses. Most everybody who attends college is over the age of 18, so that would be like the ideal participant would be a college student. And so oftentimes there's like a message board in like one of the lobbies or like the common room of a dorm building. And so if we were able to, we could post our assessment with, again, like a QR code or a link to follow that people could just do on their own time. And so some things that are important to take a look at when making an assessment are reliability and validity. So we're going to start with reliability, which is a popular way to examine psychometric qualities of an assessment. And so reliability refers to the consistency of a measurement, particularly when it is repeated with a similar population of individuals or a group. And so there are various types of reliability that are useful in analyzing psychometrics and like the consistency of an assessment. But one of the ones we want to focus on is test-retest reliability, which is basically exactly what it sounds like. It's where you give the assessment and then some amount of time has passed and you give the assessment again. And you take both scores of the assessment and correlate them to get the reliability score. Now, this is a pretty easy way to get reliability, but it also comes with the caveat that something could happen in between those two tests that could influence the second score. Perhaps the person gets more information about stress, or maybe a big life event happens and it's very stressful for the person. Then it would be difficult to test the reliability. But one of the reasons we did choose this option to test reliability is because it is fairly simple. And it doesn't require a lot of time or effort. It really is just you give the assessment and then you give it again. Another test that we could perform is it's called parallel forms reliability. And this is very similar to test-retest reliability in that you give the assessment once and then you give it again. But the second time it's similar, but it's changed in some way, whether that means you put the score that was last first or put the questions in a different order. The important thing is that all of the questions remain the same and no wording changes because they have to be identical in the content. And so parallel forms is essentially safer than test-retest reliability because there's not the option for something to happen in between the two, and parallel forms are often given in succession. And so again, we decided to choose this one because we thought it would be a fairly simple and easy way to test reliability. And then the final reliability measurement that we think would be a good way to test reliability of our assessment is the Kuder-Richardson Formula 21. So this is a measure of internal consistency that measures a homogeneous behavior domain that uses a specific statistical formula. So this test does take a little bit more time because it involves crunching some numbers, putting things into the calculator, and really understanding what you're calculating. However, it does give a concrete number to evaluate in terms of reliability. It's also helpful to kind of compare all three of these reliability tests to see if they are similar in their results. And it's just overall very important that reliability is tested to gather information about whether or not the assessment that you created is sound or not. And the main thing is you don't want to inflict harm on the people that you are giving this assessment to. So the next thing you want to test is validity, which is another important psychometric, and it should be analyzed as a way to decide whether or not to use a certain instrument. Validity concerns what the instrument is measuring and how well it does what it intends to do. But it is also important to know that before you can even test validity, you have to know whether or not the test is reliable. And so there are 4 validity tests that we're thinking could be helpful or beneficial to our assessment. And so the first one is content-related validity, and it concerns the degree to which the items on the test measure what is intended. So essentially, this validity test wants to examine how well the items actually measure stress. So if we were to give a test and it didn't, and we said that it measured stress, but it really didn't, then it would not be valid, and it would not have any content-related validity at all, because it would not measure the stress like we had said it did. And we don't want to create this assessment that we said is about stress, and then we give it to people and it doesn't actually end up measuring their stress levels, but instead measures something completely different, like anxiety or depression or something. That's not what we're intending. And so it's important to measure that. It's also important to measure how well an assessment predicts an outcome, which is where criterion-related validity comes into play. And it's concerned with the degree to which an instrument is related to an outcome criterion. That is, to what degree does the assessment predict a certain outcome? So in terms of our assessment, it would be important to assess criterion-related validity in terms of, does this assessment predict someone's stress levels now, or how stressed they will become in the future? And we would want to measure this because if it doesn't predict stress levels, we would want to reevaluate our assessment and make changes to the content so that it actually does measure what we said it does, so that we can therefore actually measure stress levels and see if it does predict an outcome of stress. The next validity assessment that we think would be beneficial is construct-related validity, which concerns the degree to which the assessment measures a certain theoretical or hypothetical construct. And so this test measures whether or not our assessment actually measures stress compared to other assessments that measure stress or similar constructs like anxiety or maybe like a phobia or something. And so we want to confirm this validity measure, because if our assessment did not align with other stress assessments, we would want to revise our questions and kind of reevaluate where we went wrong there, so that in the future, when someone takes this assessment, they will be able to compare it with other assessments that measure something similar. And finally, we could use face validity to examine the validity of our assessment. While face validity is not exactly a validity measure, but it's still important to include. And it basically means, like, when you look at the assessment, does it look valid based on what content is there and the questions that are asked? Again, this is just a very quick and easy procedure to do. It's just basically, you just look at it. So it's simple, it doesn't take a lot of time, and it provides a quick response. And so basically, validity is important because it's important to measure when you're creating a new assessment, so that other practitioners or clinicians know whether or not they want to use this assessment, because if it's not valid, then they're not going to want to use it. And again, like I said before, it's important that the assessment doesn't cause additional harm or create problems. So running these statistical tests to measure validity and reliability are very important.
So moving on to the final part, the practical application of the assessment. So this assessment may be beneficial in informing the treatment and interventions for stress in a handful of ways. So the use of this assessment can, like I said before, help the client recognize the degree to which they're stressed. So whether that's a low level, a high level, or they fall in the middle at that moderate. And it's been analyzed and shown that the use the self-recognition of that level of stress, it actually benefits future treatment and interventions because it provides the client with sort of a clear direction in where to move forward with coping strategies that prove to be useful for them. And, it can be done more on an individualized basis. And moving forward with that individualized basis, it provides more insight for the therapist and the client. So those last, 8 questions about those life circumstances, it allows them to, further extrapolate their assessed level in order to really try to indicate where that stress originates from. So if it, like we said, starting a new job, if it was a significant change in your relationships or a personal loss, whatever it may be, see if they can pinpoint that by using those last 8 questions and helping therapy be a little bit more effective, help them really tailor it to make it the most appropriate for that person. And lastly, it really creates a foundation for understanding the individual level of stress. So understanding how an individual is stressed really helps the treatment process and tailor treatment a little bit more. So like if one person was like having treatment and that was proven to be, having positive results, but they were experiencing high levels of stress due to something at work, that same treatment may not necessarily be as effective for someone who is stressed due to, say, the deterioration of a significant relationship. So it can really be proved to be useful in informing treatments and interventions by examining all those different aspects of what stress is, how much stress do you carry, maybe what those physical symptoms are, and really try to pinpoint and define what that root of the stress is. And so the big question is it better than, what is already out there? So Caitlin mentioned 3 assessments at the beginning. Like she said, the most common one is that perceived stress scale. And what we did was we reviewed it and we tried to make ours more updated to fit with societal changes. So we added questions about, how often do you use social media, or do you use it more than once a day? Things like that weren't necessarily on the PSS because it was developed in the 80s, and stress looks a little bit different now, and how we cope with stress looks a little bit different now, and where we get our stress from is a lot different than it was back in the 80s. Not only because of societal changes, but advances in technology, changes in expectations for what is quote unquote desirable when it comes to jobs or education. And then compared to the Ardell Wellness Stress Test. So on this test, it was sort of interesting. They had negatively scored items, and what their scale was to ask you how satisfied you were with a certain aspect of your life. And so if you were, let's say, I think one was extremely satisfied or elated, something like that, that you would get a negative score. Oh no, you get a really high score. But if you weren't satisfied, so if you were extremely distraught, I think was one of the choices, then you got a negative score. And so when you put all the scores together, like you would subtract and you would add. And that seemed a little confusing. The word choice was kind of wonky. And so the overall scale of it wasn't necessarily impressive. And it assessed introspective items and satisfaction. So it didn't necessarily relate to, symptoms of stress. So what we decided to do was sort of incorporate those introspective items and satisfaction items with symptoms of stress that are seen more negatively. And lastly, we compared it to this stress coping resources inventory, and all it did was ask you like how often or frequently, something like that, you engage with a coping strategy or what you use. And so we feel like ours is better because ours actually assesses stress and its accompanying symptoms rather than coping techniques. And likewise, so just to sum it up, it evaluates symptoms and significantly stressful life events or events that can be considered significantly stressful depending on the individual. And we also had positive items on our test, which other assessments did not, besides that coping strategies one. But we added items like relaxing, focusing, exercising, asking if they had high levels of energy and motivation, if they were meeting deadlines, things that are opposite than the symptoms of stress that you would normally see. And like any assessment, there are definitely strengths and limitations. So we'll start off with the not so appealing. We'll go with the limitations to start. So the items that involve symptoms of stress, things like muscle tension, if you haven't been able to focus, if you've been worried, changes in eating and sleeping patterns, those kinds of things can also be associated with other mental health problems, possibly other physical problems. So a lot of those symptoms I just listed off, as some of us know, are symptoms that you would find in someone who is maybe anxious or depressed. So there could be a little bit of a crossover there. And it also doesn't take all life circumstances into consideration. So we chose sort of specific ones, and there might be other life circumstances that are stressful for individuals that maybe we didn't list. And it also doesn't assess the use of coping techniques. So although we did have those positive items, they're not necessarily coping techniques, and we didn't really ask about them besides that negative one of alcohol or nicotine use. And also it's a self-report. So like any self-report, an individual can, fudge their answers, they can lie a little bit, but it's just up to your ability to trust that they answer open and honestly. And to finish it off with the strengths, so one of our strengths, we believe, is that it evaluates an individual's behavior, emotions, and their cognitions. So it takes all of the symptoms of stress into effect. It evaluates the individual as a whole by also taking potentially stressful situations into account. So seeing how those situations and their physical symptoms interact with each other, how stress really prevents itself. And one of our pieces of feedback that we all kept getting was that it was very clear. The wording was clear, it was easy to understand, it was easy to follow and score. And that we felt was one of the most important strengths with the creation of the assessment.
So this is just a space to open it up for any questions that people may have. And then these are just a list of all of the references and resources that we used in order to kind of create our assessment, learn more about stress assessments that are currently available, and work on thinking about what validity and reliability tests could be given to our assessment. And that is all. So, thank you.
Thanks, guys.